we're going to show you the hip mobility prescription. So if you failed your hip mobility test, which was basically you're going to keep the leg here, try to turn it in with just really using rotation of the femur, you should get about 35 degrees, 40 degrees each way. So if you failed external or internal rotation, this one's great for you. So I like to get in with the trigger point foam roller right on the glute, and I'm just going to kind of go up and down with the leg crossed or the leg flat. Just work on those hip muscles, those external hip rotators. That's a good one. So remember, 20 seconds up and down, 20 seconds side to side for a total of about 2 minutes. Usually we'll soften those muscles up. 1 second, buddy. The next thing I like to do is get these resistance bands right here. This is really good. The reason we use resistance bands is because if you think of your hip as a ball and socket joint, we can always stretch the muscles around there, but it's hard to actually stretch that articulation, to stretch the ball and socket capsule. You need to kind of distract it and stretch that out to really start to get some motion in the joint. So what we do here is we get this around our knee, lift our foot up, and now we're going to really kind of cross that foot over that figure four stretch and just push down. And that's really going to stretch the hip capsule, stretch those external rotators. You can even kind of rotate and start to get a little bit of that low back in there. So that's an excellent one for the hip external rotators. Now from here, I can also stretch the internal rotators. So if you kind of failed that test where you were going in like this is a very important range of motion that we need to have. So what we do is we get on our side like this.
Ozzy, stay out here.
Gonna move that band up a little bit. And we can use a kettlebell to kind of block our femur or something kind of heavy. And from here, while it's stretching you, you're gonna just internally rotate that hip. So you're gonna pull your foot out like that right there. And you'll start to feel sometimes a little bit of a pinching in that hip. If it's too uncomfortable, then don't do it. But this is an excellent one. So we're gonna hold this for a total of about 2 minutes, and you should feel a nice difference. When you're done, go ahead and test again and see if you have more range of motion in that internal rotation and external rotation than you should. That's our hip mobility prescription.